me instead of the camera.
Okay.
And I do have a bit of an outline I might glance at here and
Yeah,
there.
yeah.
But overall, just trying to understand how you determine how many slots you guys are opening for. What's the community need, and how are you determining that?
Absolutely. This is a really involved process. So we work really closely with the regional early learning hubs who conduct community needs assessments to understand, based on census data, what is the amount of eligible families in their region. Now, of course, census data is countywide. Our early learning hubs span multiple counties in many cases, but they look at the priority population. So within the number of eligible families, in this case, families at 200% of the federal poverty level or below, generally speaking, how many of those folks are under-resourced and underrepresented and need access or have the most difficulty gaining access to high-quality preschool programming. And that then determines the number of families that we're trying to reach, as well as the types of care needed. Is it culturally responsive care, language in a particular language, in a specific setting? We know a lot of our families of color prefer home-based settings, for example. Are there odd-hour needs? And all of this is taken into account as we work with the hubs to determine the range of slots that the early learning hubs and the child care resource and referral entities should try to recruit providers for in order to make slots available to families.
So is there any understanding of how many of these families actually want to put their kids in a daycare?
Absolutely. A big part of this, and our early learning hubs actually have families on their governance boards as well, is who's interested in care. We know when we talk about universal, it's not usually 100%, it's 70 to 80%, because there's a good chunk of families that don't need it, don't want it, and we're trying to make sure the families who do need care find access to that.
So the slots that are being open are because of the families that actually want and need access, and not just the census estimate?
Yes, that's accurate. I think one of the opportunities that as this program has grown we have is how do we hone in at the neighborhood level. When we're talking about a county, when we're talking about a region that is such a large amount of space, and some families don't want to drive across town to get to care. So I think one of our next phases in working with the hubs is being able to create a procurement system that's responsive, could do things like rolling applications, so that if it's a small neighborhood in Nyssa, we can wait for the provider that we need in Nyssa to apply for services, and we don't distribute those slots to a different part of the region.
So your report today mentioned that there's 84% enrollment right now. I pulled reports, let's see, it was February was the last report, and I had seen a 74% enrollment at the time if you're counting those who were NA, so they didn't report anything at all, as no slots. If you count those as with slots, it's still only about 79% enrollment. So were there any people that didn't report in your last, were there any NAs in your reporting this week?
Yeah, there are a couple of programs that haven't reported, and we've been working with them. We've actually got a policy that we've implemented that if they are not responding to reports, then they will not get their next drawdown of funds, because it's important that we're able to really monitor and see if there are issues or concerns with programs. We also know that families move, and sometimes you're going to have a gap in services just because that child moved out and we've got to get a new family in. And again, we think about mid-year enrollments in programs. Sometimes the timing just doesn't work out and you're going to have a vacant slot for a while. And so that's why it's really important with these weekly reports. It gives us a much better pulse on what programs are experiencing and what families are needing.
So with that 84%, then how many NAs are there?
I'd have to go double check, yeah.
Do you know an approximate? Was it more than 5, less than 5?
I don't know.
Okay.
I don't know.
And how are you counting those NAs? Are you counting them as fully enrolled or not enrolled at all?
So for those ones, we're basically removing how many slots they would have from the equation, because we can't presume they're zeros, and we're not going to guess that they're halfway
enrolled. So
enrolled.
you're just taking those slots out altogether. Okay. And then according to the report that you sent, they need to be 75% of their expenses going to staff. Now, I pulled expense reports for the 2020 to 2022 year, and that wasn't the case for most of those grantees. Some of them were reporting under 50% going to staff and salaries. How are you guys looking at that?
Yeah, 75% represents about how much it typically takes. So when we think about the operating budget of a typical early learning program, preschool promise or not, about 70% of the money they're taking in is going to personnel costs. Every program has different business models, so that's going to vary. It depends on if they're leveraging multiple funding streams, private pay families, public pay opportunities. And during the pandemic, we know that some programs were not able to retain all of their staff, especially as we saw that significant drop in the early childhood workforce when the pandemic first hit. And so that meant that program may have had less of their dollars going to staffing, and again, focusing on that stabilization of the program, regardless of sort of the programmatic needs and the level of enrollment, so that we could have that supply when we emerge from the pandemic.
So 75%, is that a requirement or is that a rough estimate? Because it sounded like from your report it's a requirement for them to be spending it on staff.
It is a rough estimate. It is recognizing that we built this funding formula based on the typical budget and operating structure of an early learning program, and so typically we see 75% of costs going to staffing.
And are you doing anything to make sure that those grantees are increasing their pay to staff? If that's something, if they're having issues with staffing, are they increasing their pay to staff when sometimes 50% of their grants are going to staff and not hire?
Yeah, so we work closely with the program. If part of the challenge in reaching full enrollment is that they can't get a teacher on board to open the classroom, then we're working with them around what have there been recruitment tactics for the workforce. Are there opportunities to offer incentive bonuses, wage increases with the funding they have available, or other tactics that may help? We also know, as with other sectors, there are particular regions of the state that are just difficult to get the workforce there. And so some of those responses and strategies are going to be different than if you're in Multnomah County trying to get a workforce, and recognizing that we are in a much more competitive workforce environment, and that you can make the same wages with better benefits in some cases at Target or Starbucks than you're going to make in an early childhood setting.
So if the issue is staffing, and the reason why they don't have enough slots is because or they don't have enough people filling those slots is because they don't have enough staff, I'm confused on, they're supposed to be fully staffed for the amount of slots that they're getting awarded beforehand. So how is staffing an issue?
Staffing is one of the issues. So in some cases, they might have lost the staff after they got their grant agreement, and this gets back to the ready facilities provision and how we're adjusting for next program year with the pandemic fully behind us. Also recognizing the delays in getting dollars out the door. They might have had somebody ready, and then they lost them either due to background check delays or just other better paying opportunities to just the natural attrition of the early childhood system. There are other reasons for low enrollment, in part, just the time of year that dollars became available. We know November is not the time that families are looking for preschool, and so really taking a step back at how we can adjust our structures and our timelines as a state agency to be more responsive to the natural needs of community.
So during the 2020 to 2021, none of the money was given back because you had mentioned that was not the practice for other states, et cetera. The next year, was any of the money given back for the slots that were under-enrolled?
We did not implement the low enrollment threshold policy until the 22-23 year. So it wasn't until the end of the 21-22 program year where we looked at reducing slots and saying, if you're going to continue, you're getting less money from us because we need you to serve fewer kids, because you can't demonstrate your ability to meet the full slot requirement, or whether they had sufficient plans in place that they really demonstrated that they did anticipate to meet those thresholds going forward.
But if the money's practiced, so if they're getting this grant and then they're moving forward with fewer kids than what was anticipated, are they giving any of that money back, or do they get to keep the full amount?
We approached the 2021 and 21-22 program year with the pandemic lens. So we were not in the practice of clawing money back from providers. We were focusing on stabilizing the limited availability of care. Going forward, heading into this program year, the 22-23 program year, programs who were significantly under-enrolled received that reduction, and then we're working with them if they're continuing to not meet enrollment threshold requirements on an action plan. We're also looking to make sure that they're not drawing down more resources than they should be, recognizing the under-enrollment and recognizing the fixed costs that are there regardless of the number of children enrolled.
So does that mean if they're under-enrolled, they may be required to return some of the money?
If they're under-enrolled, they likely will not end up drawing down all of the money. So it's not a return. They've got a grant agreement that says you're going to get $100,000 or however much it is, and they have to draw down quarterly, monthly. They all can do their own intervals. So it's not about taking the money back from them. It's about determining whether they're going to get it.
Okay. And then based on that, so I looked at some of the expense reports. Are these grantees required to submit any receipts for their spending?
At this time, no, and that's one of the advantages that we have as we create this new grants management system, is we'll have a much more centralized and robust way to take in information. Also recognizing the administrative burden of accepting public dollars is often a reason why many small businesses choose not to contract with the state. So finding that balance between making sure we can be accountable for where dollars are going and recognizing the accountability that's applied to other sectors outside of early childhood and being consistent
this new data reporting system, are there going to be receipts required for their spending?
It will all depend on what the system can fully do. We're still in the process of procuring and developing that system.
So I guess that's part of what I'm not understanding here. I mean, if I go on a work trip, I go out to dinner, I expense that, I need to submit a receipt. That's pretty much true for every taxpayer in America. So why is that not true for people we're giving millions of dollars to?
It varies depending on the funding stream when you're talking about public funds. So when we think about what schools are required to report in order to receive money from the Department of Education, the state school fund, it is not going to be necessarily a receipt for everything that was purchased. We're also looking at what are the different proxies and ways we can collect information, and then how do we have a system that can actually take in that information so that we're not collecting it and not doing anything with it. And that's where we have an opportunity with this new system to really be intentional about the processes and procedures we put in place so that it's actually doing something and that we're able to reflect back on purchases that were made as a part of the allowable uses in the grant agreement.
Okay, one more question. There are some concerns with those expense reports. For example, I looked at one child care, I'm not going to mention it because we're on camera now, but I can send it to you later. They had claimed $4,000 one month, $8,000 another month. It was a regular for rent on a home that I looked up the property tax records, the same name of the person who owns the daycare. She bought the home in 2000 for $200,000. How is this costing her $4,000 to $8,000 a month in rent, and why isn't this being looked at? These are taxpayer dollars.
I'd have to look at the grantee. It's also important to note that many child care providers don't operate in their home, so if they're a certified center, they're paying rent or a mortgage on a completely separate facility from the home that they live in. So when we're looking at allowable uses, one of the things that we've started doing with this program year is looking at those inconsistencies or follow up with grantees if something is inconsistent or seems out of the normal range to better understand or request further documentation to understand those discrepancies.
One last thing I wanted to ask. Did this program grow too fast? Would you say it's accurate to say that there were growing pains and that some of this money could have been saved if we had rolled it out a little slower?
I think had the pandemic not hit, we'd be having a very different conversation.
Anything you want to add that we didn't cover?
No, just appreciate the time, and I think we're really excited to be able to build this new agency and create a system that's going to be more responsive to the needs of community.